Hey everybody, welcome back to Leosophy. This is part 2 of the Herbalism series. And for this one, I thought instead of a regular category of herbs, I thought I would actually go over some of the herbs that are just incredibly common, at least in the West, for treatment of everyday problems. These are the kinds of herbs that you probably have at least one of them in your house and don't have the associations or stigma that a lot of other forms of herbal medicine have. These are the things that, even if you go to a more non-holistic doctor, a doctor who doesn't take other components of lifestyle into consideration, even they would probably be pretty quick to recommend some of these. So, case in point, you go to a doctor and you say, I've been having trouble sleeping lately. I've been kind of stressed out from work and a few other things, and it's been a little bit difficult. That's all. Unless you have like a full blown like drug dealer doctor who's like, hey, well, here's a bunch of medicines for that. Again, we're talking about very minor things that are not cause for tremendous concern. They might mention, well, if you have insomnia and a little bit of anxiety, you might want to consider chamomile and or valerian. They're used in tandem quite frequently. In fact, you can go to the grocery store today and go to the tea aisle, and you will almost certainly see at least one chamomile tea, at least one valerian, and probably something that combines the two. So they're very commonly used in conjunction with one another. Valerian is much more associated with insomnia, and chamomile is more associated with anxiety, but there's a synergy there, so you see them together quite often. Additionally, chamomile actually has two other common uses. Some people actually have many people have taken chamomile pills, so a much more concentrated dose, as an antiemetic, as a nausea control during chemo. And that's a very genuine treatment. Now, that being said, there are plenty of things that I think would be better, some of which are illegal, including in my state, but chamomile does have that benefit, so it is something to consider. Lastly, chamomile is also used for, another cancer treatment. It's actually very common when someone undergoes radiation treatments to have skin irritation as a result of that radiation. Well, chamomile actually applied topically can reduce that irritation. So that's a very common one. So you probably have chamomile or valerian in your home if you've ever suffered from any degree of anxiety or insomnia or any combination of the two. Another super common one, I mentioned this actually in the first episode, but ginger is really, really effective at treating nausea, doubly so for motion sickness. To a point, I actually know people, this is anecdotal evidence obviously, but I know people who have pretty intense motion sickness who've gone on cruises and only treated it with crystallized ginger. Now, I think those are some special cases. I think that there's actually a lot of other things you can do, natural things actually, that you can do to ease motion sickness, including a band over a portion of the wrist that actually has a nerve that has a direct correlation with nausea due to motion sickness. And this is something that, again, has been demonstrably verified. This isn't like, sit in the sweat lodge until the spirits come. This is not like that. This is actually a valid and experimented with technology. It's very genuine. But so is ginger. Ginger is so associated with anti-nausea effects that that's one that you will commonly hear in Western medicine, even by doctors who, again, don't look at every component of lifestyle. Ginger, big one. A couple of these that I thought to mention are a little less known, but this one's much more niche. But this is something I've seen a handful of times, but again, I only know a handful of people who've dealt with this, and all of them were prescribed by doctors in areas where, again, this is not a common reaction. It's usually, you have some chronic pain. Here is an intense pain medicine that you will become addicted to and overdose on very soon. I have a cluster flying here. Ugh. Anyway, the don't know if I got caught on camera, but one of them flew in this morning when I had the door open. Anyway, saw palmetto. Saw palmetto is actually very useful at dealing with BPH, aka benign prostatic hypertrophy, which is just a really fancy way of saying not prostate cancer, but an enlarged prostate. Now, there's been some new studies that actually suggest that it doesn't actually work. And I find that really astonishing because, again, I have seen it in widespread use. So I'm not actually advocating for it, but I am surprised because of the, again, anecdotal evidence that I've seen where it was actually prescribed by Western doctors in order to treat that. But then again, and this is where it gets really murky when you're dealing with herbalism, the effect of the mind on the body is pretty tremendous. By the way, I'm not saying that placebos are just as good as medicine. That's insanity. But I am saying that there are instances where something appears to work even when it's rigorously tested, simply because the placebo effect is so strong. So perhaps that's the deal with saw palmetto. Or perhaps there's something up with the more recent studies. So it's really hard to say with absolute certainty. One that's extremely controversial, and in some ways it really shined a rather harsh scrutinizing light on herbalism, and with good reason, is Echinacea. Echinacea, for those of you who don't remember, I think it was the late 90s. It was used for a lot of things. Like, it was flipping everywhere. It was in all sorts of natural medicines that tons of people took, and the biggest one was, well, it's the best treatment for the common cold. Everybody said that in that period of time. It was extremely common. I would have actually put it above chamomile if I had recorded this in the late 90s, because it was just flipping ubiquitous back then. But it's not very conclusive, any of the studies that it works on that. There's a slight benefit for upper respiratory infections, and that's, even think of that, not even the lower lobes of the lungs, just those. So one thing we do know is that it does affect the immune system, and it's not always good, and that's exactly why it's become such a controversy. Because here are people who are going to these herbalists, or they're going to natural health food stores, and they're buying Echinacea to treat colds, which really the downside to a cold is your immune system is overreacting to the cold virus. Colds are actually rather benign viruses, and I mean, that's not to say if there was no immune response, it would be safe. That's not what I'm saying. But overall, the really negative effects of a cold is the overreaction of the immune system. Well, people are going to get these herbs, and one thing that people don't consider is that a lot of flowers are in the same family, and it's one of the most commonly allergic kinds of flowers. Pretty much all the flowers in the daisy family. If you have, for example, ragweed allergies, and who doesn't, there's a chance you might be allergic to Echinacea. So the downside, which is a possible extreme allergic response, compared to the rather inconclusive studies that show that, well, maybe it'll shorten your cold, it's really not worth it in many instances. So something to consider, and in many places it's still a very common medicine. I'm not saying that Echinacea has no uses. I'm simply saying that it led to a lot of scrutiny because it was so overused, and by people for whom there were contraindications. So another really common medicine, and sometimes we see this overlap in the culinary world and the herbalism world, where something is really, really, really commonly used in cuisine and also really, really commonly used in medicine. And I can think of no better example. I mean, because many herbs have culinary uses that are also medicinal, but including ginger, as I mentioned. But garlic is a really common one, especially now, because you got all these boomers with cholesterol problems. Well, garlic actually lowers blood pressure and cholesterol. So big advantage. Now, I do need to stress that some of those studies are pretty mixed. And that's actually kind of a good sign when you have mixed studies rather than just purely negative ones, though, because there are a lot of things that can affect a person's response to an herb or a medicine. And I can think of no better evidence for that than the list of side effects on common medicines, which again, we're talking about minor percentages of people, but it does highlight just how different physiologies respond to different compounds, especially given that they may have pre-existing conditions that could compound those responses. Well, likewise, garlic definitely has widespread use currently as an actual medicine, in addition to its culinary uses. But it it shouldn't be taken with a number of things. There are contraindications, and I should mention that when people take herbs as medicines, they are generally taking much higher doses. I'm not saying that if you use any kind of blood thinners that you should never have any food with garlic in it, because that's probably not the case given whatever degree of severity or how much warfarin you're using. By the way, warfarin is the blood thinner that has a sort of a contraindication with garlic. It's not something that you should combine the two with, and that is because garlic actually, in addition to lowering blood pressure and cholesterol, it actually does have a mild blood thinning effect, and that in and of itself sounds not like a big deal, but the synergy with warfarin can be pretty tremendous and can make the blood far too thin. And for similar reasons, you should also not take large amounts of garlic before any kind of procedure, and that even includes dental procedures. So just something to be aware of, that garlic does lower cholesterol, it lowers blood pressure. That's pretty well established, even though some studies suggest otherwise. I'm firmly in the camp that it does. However, because it also thins the blood somewhat, there are contraindications. And with most herbs, there are contraindications. Another really popular one that I have also seen very, very maligned is St. John's wort. And it's a great example of the bias that we have towards many forms of alternative treatment. And I hate using that word just because it does sound like I am a proponent of pseudoscience itself. But I would like to mention that St. John's wort is used as an antidepressant, and it has an effect on mild and moderate depression, and that is important. And it's short term as well. So if somebody's in a rut and they are showing symptoms of depression, but not like full blown, like, intrusive thoughts, self-harm, anything to that degree, it's a really good way to shift them out of that mindset as a treatment. And then they can either look for stronger treatments, actual Western medicine, or, if they are better, then they're better now. Because it's a common misconception that all cases of depression are due to genetics and just a mere lack of serotonin, and you just need to be on these pills forever. That is 100% what the pharmaceutical industry wants people to think, because antidepressants are one of the most overprescribed and consistently prescribed drugs I've ever seen. However, and this is what I mean when I say that there's a bias. If a doctor prescribes an antidepressant for somebody and it does have a adverse response and that person commits suicide, that doctor's not at fault. And I agree with that. I actually don't think the doctor should be at fault inherently. I think other things should be considered. But if someone takes St. John's wort and has an adverse reaction, or it doesn't do a sufficient job and they commit suicide, well, then all of a sudden there's a controversy and all this scrutiny that St. John's wort is snake oil. And I don't think that that is an agreeable response, because I don't think that it is a measured or rational reaction to something that is otherwise illustrated in numerous instances to help. So that is my thought on St. John's wort. I do think that it is something to consider. However, and this is the big complaint I have of St. John's wort, it does have adverse responses with a lot of medicines. It's one of those things where, like, if you talk to your healthcare provider, if you talk to your doctor, they're probably going to be skeptical of it anyway, because it is an herb, but you still should regardless, simply because the number of interactions that it has is pretty substantial. So that is something that I think should be taken into consideration. Now, I'm going to go through, this is the last herb I'm going to cover, because this is the last one that I think is just super common. Actually, you know what? There's a couple that just came to mind that also are. I hadn't thought about ginkgo or ginseng, but those are two big ones too. Ginseng, man. By the way, all the herbs that I'm mentioning here, with the exception of the ones that I expressly mentioned controversy, are FDA approved, but that doesn't really mean much because the FDA puts very little effort into researching supplements, which herbs are usually qualified as. That being said, that does mean that they don't have certain compounds that have extreme adverse responses. So for a great example, this one's BS, 100% BS, but sarsaparilla is actually illegal. You'll never have real proper root beer because turns out if you give an insane amount of them to rats that are genetically predisposed to cancer, they will develop cancer. Big shock. Not even kidding. Sarsaparilla is illegal for that purpose. Well, it's absolutely ridiculous. So the herbs I'm mentioning, other than the ones that I've specifically stated otherwise, they have not shown any kind of severe issues like the not so severe sarsaparilla. But anyway, ginseng has a lot of potential benefits. However, a lot of it is associated with Eastern medicine, which is not my expertise, and some of it is just the fact that ginseng roots resemble a human body, a human figure. There's usually 4 roots, and it's a little stub at the very top, so it kind of looks like a stick figure. Well, there's an association in some schools of thought that, plants resemble what they help. I don't buy into that personally. I'm not 100% averse to it, but I don't really ascribe to that. But ginseng is often used for masculinity. It's supposed to, it doesn't actually raise test it's in of itself, but it's supposed to help with male problems. So there is some truth to that because the FDA straight up says don't use it with any kind of estrogens. So that alone should highlight that there is a component to it that does work in that regard. Do not use it though with a lot of things. Warfarin is another example. Warfarin has like so many contraindications though. Like you could pretty much apply that to almost anything. Like I don't even know if you should eat like food and drink water if you're on Warfarin. It's insane how many contraindications. Sorry if I'm being too hyperbolic, but still. It's also not great to take with corticosteroids and so on, and don't take it if you have diabetes, etc. So there's a lot of contraindications with ginseng, but it's also a very common thing that you might have in your home. Ginkgo is really interesting. Ginkgo is used for a lot of stuff. Ginkgo is used for asthma. I've never taken it for it. Ginkgo is used for bronchitis. I've never taken it for it. But it's most popular for numerous studies regarding mental health, specifically in the sense of like cognition. A lot of people think that it reduces the likelihood of developing Alzheimer's or other forms of dementia, and that it just enhances cognitive function, so mental health. This one is not common, but I just want to also bring it up. Lion's mane mushroom has tremendous associations with that too, and I wonder if there's anything out there that combines the two. That's just me thinking out loud, actually. So that's something to think about. Another one that I commonly see in households is ashwagandha. Ashwagandha is used almost expressly as a testosterone raising supplement, and it's the only one that I can think of, at least off the top of my head, that I would actually recommend if you have low test and you don't want to go on what's it called, TCT. It's not TRT. That's right, testosterone replacement therapy. If you don't want, if you're concerned about going on that, or you feel like it's cheating or whatever, one, don't be that worried about that particular stigma. That being said, the reason why we are in a testosterone epidemic is because of all these compounds that are, I think, deliberately being used to make a more compliant race of people. That being said, there are some natural treatments, and the one that I recommend most, actually, well, two. It's actually there's a twofold plan there, and I've talked about this in previous videos. But work out more, get more saturated fats, not a crazy amount. But ashwagandha is a legitimate treatment for that. I do think that it can be extremely helpful when used in tandem with the other things that I mentioned. Last one I'm going to mention, far less common. But it is something I still sometimes see, and I think it got a lot of popularity because of Red Dead Redemption, and that's feverfew. And you can probably guess what feverfew is for. Feverfew reduces fevers, and there are still people who absolutely swear by it. It should not be used with warfarin. Big shock. But another lesser known thing that it does is that it can actually also decrease the intensity and frequency of migraines. But if you chew on it, this is one that I find interesting. Chewing on it can actually help with mouth ulcers and digestive irritation. So that's something also to consider. So, yeah, I think that those are things to look at. One little warning. This is the last thing I'll actually say before I sign out for this video, because I'm over 20 minutes now. One thing I will say, though, is be aware that feverfew does have, I wouldn't say a physiologically addictive effect, but if you take it for migraines and then you stop, the migraines will come back. Now, whether that's because the body gets accustomed to it or whether it's just because the person normally would have it, I'm not sure. I don't think the studies have actually showcased whether that works or not. But that's my list of herbs that are extremely common in the American household. That's all I got. Like, share, subscribe, keep asking questions. Episode 3 will be out next week. Bye.